Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Top 3 tests and exercises for rotator cuff pain.
Say no more, Bob.
I'll tell you, the Vikings quarterback didn't have any rotator cuff pain when he made that miraculous throw and catch for the Vikings to win.
Did they play this weekend?
Oh, good. All right, sorry to the Saints fans. You know, we've been there. We know what it feels like, and I'm sorry for people who don't understand football. But all right, Brad. So before we go any further, we got a few fans here.
Oh, sure, yeah.
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us because Brad and I, as children, it's a sad, sad tale. We're not liked, and now we're trying to turn things around.
Yes.
So like us.
The rotator cuff, Bob.
Yep, rotator cuff.
So if you got shoulder pain and you think, oh, you know, is this rotator cuff? What could it be? And then how can I make it feel better? You know, so we're going to show you 3 nice little tips on how to assess it. 3 really good exercises on how to improve it.
Yep.
And
there we go. You'll be all set.
Exactly.
Common injury, very common injury. And the reason being is you have short muscles and long arm.
Right.
So it's got to handle that long lever arm, right? Or lever. How do you say it? Lever or lever?
Well, it depends if you're from Australia or not.
Okay.
Anyways, I just had a patient yesterday. She had rotator cuff surgery. I said, well, did you fall on it? What happened that you needed a surgery? She said, I don't know. It just started hurting, and then it got worse, and went to the doctor. They took an MRI, and there she went for having surgery. Yeah. She never even had any therapy.
Oh, wow.
So anyways, so now she's got a really stiff shoulder. She can only reach it about 45 degrees, and we've got a few.
You got some work to do.
Yeah, we've got some work to do. So we're going to, you know, sometimes these surgeries can be avoided with some preventative exercises and assessments. So first of all, if you're having shoulder pain and let's say you don't know why it happened, that's not uncommon.
No, it's not. Because it can be over time. It can be a progressive.
Right.
You know,
she works in a factory. She was doing a lot of repetitive motion. I'm assuming that's where it happened in her case.
Just deteriorates over time.
Right.
It can. I mean, especially with if you're in bad posture or bad positioning of the shoulder.
And she, you know, she was 45 years old, so that all fits as far as age and her work and whatnot. But if you have shoulder pain, a real common symptom, if it's a rotator cuff injury, is you're not able to lift up to here.
Right.
Usually you get up to around 90 degrees, you can get some sharp pain in there. 90 degrees,
a right angle.
Right. Oftentimes you'll get pain in here, and if you get past that, then it feels a little better up in here.
Depending where the impingement is.
Right.
I mean, it can hurt, you know, and keep hurting all the way up here, or it can hurt and then stop hurting.
Right.
But either way, it's kind of pointing to the rotator cuff.
Exactly, Bob.
The tendon.
The other thing is pain location. Where does the pain hurt? If it's to the side over here, sometimes if it's a bad case, going down the arm possibly. Usually not to the wrist, but sometimes. But if you get that's indicative of a shoulder pain. My wife said that I'm supposed to look at the camera more than you.
Okay.
So anyways, I would
She must be jealous.
Well, no. yeah, that'll go over good.
Yeah.
So then if you have pain back here, my guess is it's probably not the rotator cuff.
Less likely to be.
Right. And then I'm going to definitely assess the neck, because referral pain from the low neck can go to the shoulder blade pretty, you know, more commonly is my experience.
Right, and it's been my experience as well.
Right. And if you reach back like this, oh, it can hurt right up in here.
Yeah, especially compare the two.
Right.
So you're finding out this is your involved side, and you're gonna check this, and it only goes this far, but this one goes way up here.
Right.
There's your sign.
There you go. So do those tests, see what you got. If it's a positive for, you know, it's a rotator cuff, then there's 3 more tests that we can do. These are the ones I like to do, although it's kind of hard to do on yourself. One is the near test, where you take the arm and you push it up in here, and usually you can get up to about here, and once you get up in here, it gets to be some sharp pain. That's a positive sign.
And if you're doing it yourself, try to let this one relax.
Right.
Let this one relax and let the other one do the work.
Precisely. You got it, Bob. Good point. The other one is simply go across. And, you know, these are actually impingement signs, but one way or another, it's rotator cuff. And so if this one hurts and this one hurts, then I do another one called the Hawkins-Kennedy. 90-degree bend in the elbow. You're going to support here. This one's kind of hard to do yourself.
And you're about 45 degrees here, right?
Right.
Yeah.
And here, and sometimes It doesn't hurt, Bob?
No.
Yeah, and I'm not pushing hard. This
No.
is a relatively gentle test. So, if all three of those are positive, there's a good sign,
That
the
something's
rotator cuff is involved.
Right.
So,
We had another one where, I mean, sometimes you just put your hand on the opposite shoulder and go up like this. I think that was also, that might have been the end of the clavicle too. Might have been.
right.
So.
You're working,
Yeah.
testing similar structures. So, anyways, now the exercises, Bob.
Sure.
The first one, if it's inflamed, it's sore, we're going to go to the Codmans right off
Right.
the bat. And this is a real common exercise. Doctors give this to a lot of patients. They do this one so it can settle down, and then go see your therapist, and they'll guide you on other ones. So it's just simply leaning over like this. I like to put my hand on something so you can keep your back out of the picture and rest your back. And just let it relax, completely relax. Get your body to move so that that shoulder can go back and forth. The idea is the weight of the arm acts as a little traction on the muscles, get them to relax, distract the joint a little bit, get some motion in there, and you can go right to left as well. If it's feeling better, you can do circles. And the other thing is at this point, it kind of tricks the body, because right here, if I go up straight, I'm at 90 degrees, where you may not be able to tolerate it
Right.
when you're, when
And
you're
you might even
standing
go
up.
further. So I mean, if you're up to this point here and
Right.
you stand up, look how far you are.
Right. So it's a good way to kind of get that range of motion without the pain.
Can I show my variation?
Say no more, Bob. the Bob's is waiting for this one because it
Yeah,
works.
this
He's
is
had
the one
some
I
really
like.
good luck with this, and we've had a lot of good responses.
I'm just going to go up onto here. Just
Yeah,
to
go ahead,
back up
Bob.
a little bit.
Don't worry about it.
All right. So, yeah, again, 50 to 75% of the people seem to respond to this. Some
Right.
people don't. But what we're doing now is we're trying to help set the head of the shoulder down into the socket. So you're going to put your hand on a surface like this, and you're going to push down.
Going to push this direction,
Yep.
right towards your knee.
Yep, pushing toward my knee. And as I push toward my knee, I keep pushing, I walk away.
Yeah, look at right there. That's a lot of shoulder flexion. And oftentimes you can do it with that pressure pain-free, but if you're going like this, it hurts.
Right. Or even if you don't push down and you go back like this, it might hurt.
Right.
But if you don't push down, but if you push down, you go back, it doesn't hurt. So these always should be pain-free. We don't want pain. So the further you can go without pain, the better.
Right.
I'm pushing down. I push down all the way back too.
Good.
Yeah.
So you got that force going
Yep,
into the...
all the way through and all the way back. And you can do a good 5 sets, 5
Right.
repetitions of these.
Sure.
And you can do these throughout the day. You
Right.
can do it every hour if you want.
Right. As long as you get that kind of response, pain-free range is working. Get that head of the humerus set where it belongs. If you don't have one of these tray tables, you can do it on a cupboard.
You can do it on
a
a
chair.
countertop.
Right.
Yeah, anything.
Right.
I would say the next one's the same thing, Brad, the scapular retractions.
Yep.
I would do those throughout the day.
Right.
I mean, they just help set the shoulder in the right position, and they make a big difference.
So posture of the shoulder, the mechanics of it's very critical. So a lot of these exercises, what they're doing is getting, here, let's get old
Napoleon.
bonehead in here. We want to get this ball set in the socket properly as opposed to way up here where it's impinging on the acromion. So, thank you.
And the same
You're
with
welcome.
the same with the scapula, the shoulder blades. We don't want them forward. We want them back. in the
Right.
Yep. So that's what this next one is about.
Right, so we're going to retract the shoulder blade. So actually you can do this without resistance.
Right.
And it's going to be effective, but you do want to
And
go
so
ahead.
I'm just showing how the blades are coming
Yep.
together. And
Yep.
you want to, what I like about these is you can do them at your desk. You can do them all day long. You can do
Right.
them every hour.
Right.
And it's really, I advise you to do it every hour.
You're not going to do 50 of them every
Right.
hour, but you do, 5 to 10 every hour is
Right.
going to help
Make a
that
big
out.
difference.
Yep.
So-
You can use some TheraBand or resistance.
Tubing.
Tubing. There we go. And it's the same motion except for you have some resistance and it works the
Brad,
muscles.
your
a little
collar's
bit.
flipped up.
My collar, Bob.
Who
Well,
dresses you in the morning?
well,
Apparently your wife did not dress
no,
you this morning.
she was, no, actually she got up earlier than I did today. So we're working here. Yeah, but we don't want people to talk about that. Whoa, look at that, Bob.
By the way, we got to put a plug in for the wall anchor here.
Oh yeah,
This,
it's a wonderful
This
device.
is Brad's and our invention, and you can put them up at different levels, and these work great for exercise.
Yeah,
And
they do.
So,
So Yeah, you can use it. You know, therapists, you always give out this stretch.
Stretch band, yeah.
Yeah, that works on there well.
Exercise band.
Yeah. So, and then the next exercise is the famous, you know, I would say everyone who has a rotator cuff problem does
This one.
this one.
Yeah.
External rotation, which also helps that humeral head get back where it belongs. And look at my elbow. It's here, and it's not this, and I'm not going down like this.
Yeah, and some people have actually put a towel in there
Yep.
just to maintain it there.
Right. So if you have that towel in there and the towel falls out, you know you got
Yeah.
your elbow too
You've done
far.
wrong.
For,
You've
yeah.
done wrong.
Yes, that's the
the
sign.
indicator,
The
so-
towel sign, we're going
Yeah.
to call that. There we
So
go.
he's just going right across. Now you can also do it with the exercise tubing with handles.
Yep. And
You
here
got
we're
that
just
one right
going to
there.
use one. That's the nice thing about this anchor. You can, you know, use one and it's going to lock it in. Or if you want to need more resistance, you can grab both at the same time.
And that's a lot then.
Oh yeah, that's
Yeah.
quite a bit more. And I feel that rotator cuff.
That's how I do my biceps. I start with one and then I go two.
Pumped up strong,
Yeah,
Bob.
yeah. So, all right, folks. I hope that all helped you.
Right, because you get these exercises, 3 sets of 10 is the goal when you get to that point. And as it's feeling stronger, you're going to start to do this better, scratch behind your head better, maybe even get to throwing that baseball.
Yeah, or that football.
Oh, yeah, that football.
Where's Alex? I can hit
And
him.
the Vikings fans are just pumped up because they finally made it to the playoffs.
Yeah. We're beyond the playoffs. Thanks.